So I want to welcome everybody back to the YouTube channel. This is the first video for 2024, and this is an appropriate video because the codes for this procedure just went into effect in January of this year. So not a new procedure per se, but new in the sense that it will be approved for use, specifically Medicare is the one that I'm talking about in terms of approvals. But what we're talking about today is sacroiliac joint fusion or stabilization. Now, this is a procedure for somebody who's already been through sacroiliac joint injections. So if you're somebody who suffers from SI joint pain, and you've had diagnostic and therapeutic injections in the past, meaning either local anesthetic into the joint, which prove that it's the source of your pain, as well as cortisone injections into the joint, and those things actually work and give you relief, but they're not lasting, then this could be a more definitive solution. So what this is a process done in an operating room under x-ray guidance where we fuse the joint with the idea being it's going to be more of a long-term fix for SI joint pain. So you can see the sacroiliac joint outline there, and this is a step-by-step on the procedure. So essentially you're putting a guide wire into the joint. This is done with sedation, so you would be sleepy for this. Using a dilator, the joint is then entered and a little space is made in the joint with a device called the decorticator, which is essentially just scraping out a little bit of bone. This is not a painful undertaking. You're comfortable, you're asleep, you're numbed up. And then it's very simple. Once the space is created, this little pellet is dropped in, and this is bone matrix material. Which will cause the joint to fuse over a period of months, really. So you got to be careful after this not to overdo it and give that bone a chance to fuse. Usually you would be not incapacitated in any way, but you'd want to avoid heavy lifting, extreme bending. Usually about 6 weeks. This can be done with just a couple stitches, small incision. Pretty quick recoup and healing time on this procedure. So this is a nice option for people who have been through SI joint shots. We've proven that the SI joint is the cause of pain, but they're not getting lasting relief from the SI joint injections. So again, this was recently approved, and this is about a 30-minute undertaking. So this is not a long, involved procedure, but it's meant to be a definitive solution so that patients don't need to get ongoing SI joint injections. In terms of risk, obviously anytime you do an intervention, risk of bleeding, risk of infection, risk that you could dislodge this bony material, risk that it doesn't fuse after you put it in. But these are all kind of standard risks for any type of procedure, especially a fusion procedure. Now, some of the other fusion techniques out there involve putting screws in. And those screws are going across the sacroiliac joint there from outside to inside. And one of the risks with that approach is there is an artery that runs in the gluteal muscles, and if, God forbid, you hit that artery while you're putting a screw in, literally could bleed out from an arterial bleed. So this approach really has a very, very low probability of causing any kind of bleeding arterial damage like you can with a screw. One of the knocks on this procedure would be, well, you're not really putting screws in, so you're not really fusing. But over time, that bone matrix will and should cause fusion of the joint. Again, there's always a chance that, a fusion may fail in terms of the bone matrix not leading to a bony fusion, but that's pretty much true anytime you're using a bone matrix. But in my opinion, the risk benefit in terms of not having a screw there and the safety of not having to really screw across the joint and risk hitting that artery, I think does give this procedure an advantage. It also makes it less invasive, it makes it faster. So I favor this approach for SI joint fusion. And again, a win for the company that as of January of 24, this is now a covered procedure under Medicare. So I hope you find these informational and helpful. Please like, please subscribe so other people do get pointed to these videos, and I hope these help. If you have any questions, feel free to put them in the comments, but try and refrain from asking personal type questions in there, as this is not the platform to be putting out any personal medical information. Thank you.